Over the years, MS Teamworks has shared different perspectives on MS from patients, care partners, family members, and healthcare professionals. Guided by our mantra, I have MS, I have a team, I have a future, we are proud to share new messages of hope and inspiration with the MS community.
I have MS.
I'm on your team.
I have a future.
My name is Bob Shin. I'm a neurologist at Georgetown, and I take care of patients with multiple sclerosis and neuro-ophthalmologic issues. Regarding MS treatment options, it's really amazing because when I was in training in medical school, there were no treatment options for MS. So since the early 90s till now, there's been an amazing explosion in terms of our options to treat this disease. So it's almost to the point that there are too many options to go through. It can be confusing for people. Usually, when I'm talking to my patients, I try to break it down and say that at this point, as of 2019, the FDA has approved 20 different treatments for MS. We don't use all of them currently. But I try to explain to them that really 10 of those 20 were injectable therapies. So our first generation of treatments were medications that patients took themselves by needle. There are 5 different forms of interferon, so some of my patients are familiar with the names of beta-seron, Xtavia, Avonex, Rebif, or Plegridy. And there are 5 forms of a compound called glatirimur. So that came out as Copaxone 20 milligrams, Copaxone 40 milligrams, Glatopa, and now we have generic glatirimur 20 and generic glatirimur 40. So, 10 different treatment options. Since 2010, actually, we've had pills for MS, and actually the FDA has approved 5 different pills for treating MS. That includes Gilenya, Aubagio, Tecfidera, and then very recently the FDA approved 2 other compounds, Mayzent and Mavenclad. And then over the years, the FDA has also approved 5 different infusions or IV treatments to treat MS. Some of them aren't used anymore, so mitoxantrone or novantrone is technically approved for MS, not as commonly used. And there was another product that was removed from the market, so we don't really use that anymore. But that leaves 3 IV options for our patients. That includes Tysabri, Lemtrada, and Ocrevus. When I try to talk about these treatment options, I do personally clump them into those categories: our injectable therapies, our pill therapies or oral therapies, and our IV or infused therapies. With so many treatment options, it can be very confusing for the healthcare provider as well as the patient to try to sort through all of these different options. Obviously, we probably don't have time to go through every product in a lot of detail, but what I would say in general is that each of these products differs in terms of their mode of administration, whether it's a needle or a pill or an IV treatment, and the schedule, whether it's once a day, several times a week, once or twice a month, once every certain number of months. Some of our MS treatment options actually aren't continuous therapies, meaning that you might only take a couple of courses of those treatments, and then that might be the entire treatment course. So there's a lot of differences there. The factors that I think a patient might be curious about would obviously be, how is the medication taken? They might want to know about potential side effects or how tolerable it is to take that medication. But also I think they should focus on the effectiveness of the different medications. So each of them differs in terms of their relative effectiveness, we believe. And so it's really a balance of all of these factors: how it's taken, how well it can be tolerated, how effective it is, and the last point, of course, would be safety. For patients who are newly diagnosed with MS in particular, I think the best thing to do would be to be informed about the different treatment options available, but also to have a really good communication with their healthcare provider to be able to express any concerns they might have about side effects or safety issues, but also be able to hear from the healthcare provider about the effectiveness of the different drugs and why you might want to balance those different factors. When I'm talking to patients about their MS treatment options, I usually start out by trying to explain the goal of taking MS therapy. So the reason why someone might take an MS medicine is to try to prevent MS attacks or relapses or exacerbations, to try to prevent changes on MRI, so the spots that we see on the scans, and to prevent disability progression. We don't want our patients developing more symptoms and more limitations over time. So that's a reason to take a medicine. Then I kind of walk through these different options, as I mentioned. I think of our injectable therapies as our first generation of therapies. So they were available from the early 90s, and we continue to use them today. It's To speak in a generality, I would say that we've used them the longest, and I would say they have a very good safety profile because we've used them well, but they do require self-injection, and I'm going to say as a general statement that they have modest efficacy. That was our first generation of treatment options. If I look at the other end of the spectrum, I mentioned currently we're using 3 different IV or intravenous treatments for MS, and in my opinion, again in generalities, I would consider them at the highest level of effectiveness. The ones that seem to have the best effect in terms of preventing relapses and MRI lesions and disability progression over time. But I do have to explain to patients that does require a little bit more monitoring when we use those products. And so it's important to balance those factors, the effectiveness, but also the safety monitoring that would be involved. And in my opinion, somewhat in the middle would be the pills for MS. As I said, we now have 5 different therapies for MS. I look at for that balance. In my opinion, they have at least as good, if not more efficacy than maybe our first generation of injectable therapies. But they do, in turn, have safety issues. And again, each of them is different in terms of extra screening that might be necessary. So that's how I try to kind of put that conversation together. So when we're talking about the medications, we do have to talk about side effects possibly, and also safety. So they're slightly different things. So I think of side effects as symptoms a patient may experience simply by taking the medication. So for instance, many of the self-injection therapies can be associated with injection site reactions, meaning where you inject, there could be redness, there could be a bump at that site, it can be painful, so patients should be aware of how to try to manage that and sort of minimize those kinds of side effects. Some of the pill medications that we take, you take it by mouth, and we have to pay attention to whether a patient may experience stomach upset or headaches or some other kind of side effect, as we might with any medication. And some of those, let's say pill therapies, we have to do blood work to make sure that, for instance, that your liver is okay with taking that medication. So that's really all a part of taking that medicine. I mentioned with the IV treatments, we also have to be careful in terms of letting our patients know what to expect. Each of the IV drugs is a little bit different, but some patients can have reactions as they're getting the medicine. So many MS patients are familiar with IV steroids in the treatment of an MS attack. And these medicines are administered similarly, and catheter is placed in the vein, and the medicines run in over a period of anywhere from 1 to many hours. And sometimes we have to let patients know that we may even give them additional medication to prevent the infusion-related side effects. So that could be things like Tylenol or Benadryl or IV fluids, or even sometimes a little bit of steroids. So that's all about tolerating the medicines themselves. I was speaking in generalities, but we do also want to let our patients know about safety issues. I'm going to make a general statement that in my opinion, the FDA-approved drugs for MS have been proven to be safe for most patients with MS. That's why we use them, but rarely we can patients can experience different kinds of complications that we need to warn them about. But also really we as healthcare providers need to do our job in properly monitoring our patients. So patients may need to know what to expect in terms of what am I going to order? How often might I do an MRI scan, let's say? Or how often might I do blood work to keep an eye on things like their white blood cell count, or I mentioned their liver enzymes. Some of the medications in their label talk about cancer risk, and that can be very alarming for our patients, of course. What I really try to explain to my patients is that in clinical trials, we may see imbalances in numbers in terms of how many patients on drug got cancer versus the number of patients being compared to them because of the relatively small numbers. If you look carefully at the FDA labels, what the FDA usually recommends for these products where this comes up is that we all do the expected screening that we should be getting. For example, adults over, let's say, the age of 20 or 30 should be getting, let's say, annual skin exams because we all need to watch out for skin cancer. Or women may need screening for breast cancer, cervical cancer. And those recommendations evolve based on our understanding of the disease and obviously the women's family history and other issues. So these are the kinds of warnings I tell patients about, but really it's almost a reminder of the things I'm going to be looking out for to make sure that they stay safe. One question that my patients do ask me sometimes is how much do these treatments cost? As we all know, we've been talking about rising healthcare costs in general, and healthcare or prescription costs in particular. And I do have to tell my patients that all of our MS therapies are quite expensive. There's always sticker price in terms of what the official price of the medications would be, and I'm just going to speak in generalities again, but the treatments can be anywhere from $80,000 to $100,000 a year, just in terms of, again, retail price. I immediately have to reassure my patients that patients aren't expected to pay that out of pocket. So these medications are FDA approved for treating MS, and patients with insurance obviously can get the medications covered, and also our patients who may not have insurance often can take advantage of different patient support programs, whether it's MS Society that helps patients in need, or the pharmaceutical companies themselves frequently will provide medication free of charge to patients who have need. The main thing that I would want someone watching this video to remember is that there are a tremendous number of treatment options. This is a blessing and a curse, so we want to have good communication to be able to express what our goals, let's say the healthcare provider is trying to do, but also the patient needs to be able to express what they're worried about or what they're looking for in treatment options. I would emphasize both to patients who are newly diagnosed, where you're trying to make that initial treatment option, that you're never limited, you're never locked in. If you and your healthcare provider have picked a treatment option and it turned out to not be the right one for you, maybe you had trouble with side effects, maybe you didn't tolerate it very well, maybe it wasn't doing the job that we wanted it to do, there are other options that you can switch to. And similarly, for patients who have a diagnosis of MS and who are on treatment already or have been on many treatments before, it's never a bad time to reassess the options to see might there be a treatment out there that might be better tolerated or maybe more effective for that individual. So it's all about the options.